everyone is doing fine, and I hope everyone is prepared for this class. This class is very important. This is my second lecture or class with the AIU. My first one was back in July. It was on the topic of public healthcare management. This is my second class. The audience, the students loved that class, and that was a boost for me. So I decided to give it a go again. So now this is my second class. Today, our topic of our class, topic of my presentation is professionalism and communications in healthcare settings. Most of the people do know about me. I'm Dr. Omer Farooq Khan. I am from Pakistan. I am a doctor. I've done my MBBS. MBBS is basically Bachelor of Medicine and Bachelor of Surgery. And then there is postgraduate degree. I'm resident surgeon. I am doing my residency in FCPS orthopedic surgery. And I'm doing this in a very well-known public teaching hospital, Benazir Bhutto Hospital. Benazir Bhutto was our prime minister who was sadly assassinated. Benazir Bhutto Hospital, Robert Pindi Medical University in Pakistan. So I hope everyone knows about the topic, professionalism and communications in a healthcare setting. Basically, professionalism and communication is a very, very broad topic. It can fit into every field. It can fit into every kind of, scenario. But right now, me being a doctor, a healthcare professional, we will talk about professionalism and communications in healthcare settings. Is my voice clear to everyone? Because I want to continue with this notion that my voice is clear to everyone, or do I need to talk slow, or is it okay for everyone?
The pace is perfect, Dr. Omer. Your screen is very clear. And,
thank you, sir. Thank you.
Everything is working fine.
Thank you, sir. Thank you. So, introduction. Today's topic of our discussion is about a very important topic, which is equally important in every field and not just health sector. The thing I talked about, professionalism and communication, can fit into every kind of vocation, every kind of field. Although we are going to talk about healthcare settings, but professionalism and communication is a broad thing. It can fit into every kind of vocation, every kind of field. Many recent researchers have strongly suggested that better productivity and work ratio are closely linked with a healthy and respectful professional workplace. If you have a healthy professional workplace, if you have a very healthy workplace environment, the productivity of the workers, the productivity of the workforce, and their work ratio increases exponentially. I'm not talking about percentages. I'm talking about exponential figures. So the productivity becomes twofold or even fourfold when you give a good environment to your workers. If somebody loves doing their work becomes passion of their life as well. And when your work becomes passion of your life, you are one of the few lucky people, because many of the people do not like their jobs. They hate their jobs. And when you hate their job, you consider it a burden. And when you consider it a burden, your productivity becomes down, almost zero. So whenever you are loving your job, you're loving the workplace of your job, your productivity increases. It's as simple. It's simple mathematics. There is no rocket science behind that. In healthcare sector, professional grooming and effective communication of healthcare professionals has even more importance as we are dealing with human lives. And sometimes in emergent conditions, an error or delay in proper communication of patients' data or needs can result in catastrophic outcomes for the patients. So today, the learning objectives of our topic are, we will talk about definitions. That is my style of giving any presentation. I do not go ahead without talking about the basis. I always talk about the definitions first, then I go to talk about my topic. So first we will talk about the definitions, then importance of professionalism in healthcare settings, then qualities of good professional and professional communications, then communications between collaborating physicians, communications within healthcare teams, interaction of healthcare professionals with patients, and principles of medical ethics. So just as my style is, definitions. What is a professional? First of all, if you talk about professionalism, professional communication, professional workplace environment, everything related to professional, you need to know who is actually a professional. A professional is a person who possesses a specialized knowledge and has gone through long and intensive training and academic preparation to achieve specific set of skills and knowledge needed for their respective vocation field. So a professional is a person who possesses the specialized knowledge of his specific vocation or field and has gone through long and intensive training and academic preparation to achieve specific set of skills and knowledge needed for their respective vocation or field. I will not give you any other example. Me being a doctor, my bachelor degree was a 6-year program. It was not a 4-year program. It was not a 3-year program. It was not a 5-year program. I got my bachelor's degree after 6 years. So, my field is a bit more, difficult kind of field or more demanding field. So the learning curve is longer. And as the learning curve is longer, your bachelor programs gets longer. So I'm just talking about, for me to be called as a doctor, to be called as a physician, or get a license to become a registered medical practitioner. And even in Pakistan is not that much developed nation or something like that, but our standards of medical professions are as high as any other country. So to become a registered medical practitioner or simply a high-level healthcare professional, I had to go through a 6-year intensive academic preparation as well as training program to become a bachelor in medicine and bachelor in surgery. And now from last 3 years, I'm doing post-graduation in surgery. I wanted to become a surgeon all my life. I loved orthopedic surgery. And now, it's a 12 years journey, 11 years or 12 years, depending upon your luck, 11 years journey to become a consultant, So to become a consultant, I needed 11 years. So that is just an example. To become a world-class professional, you have to attain a specialized knowledge and get long and intensive training. What is professionalism? Professionalism denotes a series of skill sets and behaviors, not just skill sets, behaviors as well. Each and every word of the definition is important. Professionalism denotes a series of skill sets and behaviors that demonstrate that a person has achieved status as a professional in any specified field. These are basic definitions, general definitions. So I will not just link them with healthcare sector. Professionalism is a broader term, so I'm talking about broader terms. Professionalism denotes a series of skill sets and behaviors that demonstrate that a person has achieved status as a professional in any specified field. Remember the word behavior. Healthcare professional, our topic. A healthcare professional is the person in job. I could use just the word job, but I am using the word important job because it is very important job. A healthcare professional is the person who's professionally trained and assigned the important job of providing specific healthcare services to the patient. I'm talking about specific healthcare services because these days, healthcare sector has diversified. There are many subspecialties. There are many super specialities in the field of medicine, in the field of surgery, in the field of robotic surgeries and whatnot. You are having proper nutritionist system. You are having doctors of physiotherapy. You are having doctors of pharmacy. You are having every aspect of healthcare sector has been diversified into specified professional roles. So a healthcare sector, a healthcare professional is the person who is professionally trained and assigned the important job of providing specific healthcare services to the patients. A single patient may be getting healthcare services from a team of healthcare professionals. There might be an endocrinologist on the panel of his healthcare professionals. There might be surgeons, there might be oncologists, there might be medical specialists, there might be liver specialist if he's having some disease related to the liver, who is also causing hormonal imbalances in the body as well. So you need a endocrinologist for hormonal problems, hepatologist for liver problems, surgeon to do surgery of the, for example, if there is a tumor of that tumor of the liver, and so on. Professional communication, that is the second part of our topic. So what is professional communication? Professional communication is defined as oral, written, digital, or visual forms of information delivery in a workplace. So professional communication is not just a written form of orders, a written form of communication. It can be oral as well. Whenever your senior gives you a command by simply asking you something, that is also a professional communication. You cannot deny that. Then he can also give you a written order. He can send you a message via some digital platform. He can simply guide you through some visual form of order. So all forms of information delivery in a workplace are called professional communication. And right now it's an age of information technology, it's an age of internet, it's an age of digital media. So professional communication also involves various forms of speaking, writing, and responding within and beyond the workplace environment. So there are times when you are not at your workplace. It happens in our profession too much. You are not at your workplace. It's not your call, but then again, your senior calls you back to the hospital because there is an emergency and the on-call team cannot cope with that emergency alone. So you have to come back to the hospital and you have to help them in saving the life of that patient, whoever that patient is. So professional communication also involves various forms of speaking, writing, and responding within and beyond the workplace environment. Right now, there are many WhatsApp groups, which are official WhatsApp groups of the units of the hospital, of the units of the any organization, where they use formal language. They talk only they talk about their professional workplace things. So all of these things are also involved in professional communication. So importance of professionalism in healthcare setting. Although I did talk about this earlier as well, I will just go through it. Healthcare sector deals with ailing humanity and provides life-saving goods and services. Therefore, world-class professionalism and good leadership are vital for this sector. It's not some retail sector. It's not some simple services sector. It's not simply car industry. It's not bike industry. It's not something which is not related with human lives. Our profession becomes important. Healthcare sector becomes important because we are dealing with ailing humanity. So the morality of the task being given to us, morality of the things done by us has to be governed by very specific and very harsh, I will use the word harsh, very harsh set of rules. Whenever you are dealing with ailing humanity, whenever you're dealing with human lives, the scrutiny becomes intense, and your demands of the profession and the demands of your workplace environment, you can simply say the stakes are high. So you have to behave very professionally. You have to get very important knowledge. You have to keep yourself up to date to provide very good health coverage to the public. Healthcare sector provides services and products which reduce services sufferings of the people. Our sector treat illnesses and potentially save their lives. Thus, professionalism and effective leadership becomes even more necessary for ensuring that every task is done correctly and that everyone stays safe and healthy. Look, our field becomes even more important than any other field because we are directly dealing with human lives. So you have to set very high standards of professionalism for healthcare professionals. Whenever a healthcare professional behaves in a highly ethical and professional way with the patient and other healthcare professionals, the patient care and the patient satisfaction rates become optimal, resulting in better outcomes. Well-being of patients as well as all the colleagues working around that person as a team gets a boost. Patient gets a boost, your team workers get a boost, they stay happy working around you. Nobody sees you as some kind of uh, uh, a very tough person or a very rigid person. You have your own limits. You are professionally and morally moral integrity. Your moral integrity should be very high, but you're dealing with the people should be very, very calculated. You're dealing with the people should be very friendly. We will talk about these qualities later, but whenever you behave in ethical and professional way, the patients get happy, your teammates, your co-workers get happy, and the workplace environment becomes better. Patient safety becomes your topmost priority. And whenever you are being professional, the honesty is the basic pillar of your moral integrity. You stay honest with your job. You don't miss things. You don't leave the patients unattended. And respect for others is mandatory in this profession. And more important, confidentiality of patients and colleagues become important. So all of these things I will discuss later, but all of these things are part and parcel of professionalism. Whenever professionalism is practiced in its truest forms, the workplace becomes a heaven, literally a heaven. Everybody loves doing their work. Qualities of good professionals. So whenever we talk about professionalism, you have to talk about the qualities of good professional. Who actually is a good professional? How will we quantify someone as a good or bad professional? So who are good professionals? First of all, competence to get the job done and get it done well. Their abilities match the requirements of their role, and they often produce results that exceed expectations. If somebody expects something of you and you go 2 steps ahead of their thoughts and you do something even what they were not expecting, they will be amazed. They will be amazed. Why would they not call you a competent doctor or a competent healthcare professional when they see you do something which they didn't even think that you could do it? So if you get the job done and get it done well, and you break the expectation, you exceed the expectations of your seniors and your colleagues, you are a competent person. If a healthcare professional is competent, then their professionalism allows them to manage their own and others' expectations. And most importantly, a good professional knows when to ask for help if needed. Me being a surgeon, that is the most important thing. You know, being a surgeon, you have to know your limit. I am giving examples from my life because if you're doing a surgery and you think that that kind of condition or that kind of problem with the patient is above my scope, I need to call my senior, I need to call my supervisor, even professor, then I should know that when to call them. And I should know that whether I can handle this kind of problem in the patient or not. For example, I'm doing a laparotomy. Laparotomy means any abdominal surgery. If I have opened an abdomen and I see a very large tumor, a very large mass, that I find that I cannot resect it, I cannot remove it alone, then I need to know my limit. I have to call my supervisor, I have to call my senior, instead of trying it alone, and there is massive blood loss and patient is bleeding and I'm just shouting in the operation theater and I'm unable to manage the problem myself, but still I'm not calling the help. So if you are a good professional, you should know you know that you are competent, but you cannot be omnipotent. So you, even if you are competent, a competent person should know his or her limits as well. When to call for help, that is also a trait of a competent person. Knowledge. Professionalism needs detailed, up-to-date, highly specialized knowledge. I'm using every single word with a thought process. Highly specialized knowledge. So a good professional strives to increase his knowledge at every stage of his her career and keeps adding to their skills. It's not like if you have become a senior, you start thinking that you know everything. You never know everything. You never know everything. There are many instances where when during the workplace environment, during discussions about a teacher, patient's condition, my juniors told me something which I didn't know. And I shouldn't be bothered by it. My ego shouldn't get hurt. If some junior makes if a junior makes me learn something new, if a junior corrects me if I am wrong, so if I am wrong or if I am lacking something about a specific condition or a specific disease, I'm lacking some knowledge, I should be ready to learn. So you keep updating your knowledge till the end of your life. So you never start thinking that you know everything or you have gained maximum knowledge. There is no such thing as maximum knowledge. So this is part and parcel of professionalism, that you keep detailed and up-to-date, highly specialized knowledge of your field, but you are eager to learn from wherever you get knowledge. Conscientiousness. A professional has to be thorough and reliable, setting their own high standards, and be careful about every aspect of their role. If you are a thorough and reliable person, then anybody can rely on you. Anybody can give you a job, and they will be thinking that now that patient or that person is in safe hands. You have to be thorough and reliable about your job. You don't miss things, especially things about the patient. If you start missing things about the patient, sometimes patients die. There are some mistakes when you miss things about the patient. Sometimes you miss a thing and patient gets administered wrong kind of disease medicine, and that patient dies. For example, if a patient is allergic to penicillin and you didn't inquire about any kind of allergies, or even patient told you about the penicillin allergy, and the patient gets admitted in the hospital and you did not intimate this about penicillin allergy to the other healthcare professionals, and he gets administered with penicillin, patient may have anaphylactic shock. Patient may die just because you missed it, just because you didn't tell other healthcare professionals that the patient is allergic to penicillin. The patient lost his life. So you have to be thorough, you have to be reliable, you don't miss major things or minor things, but especially things like these. I gave example. So you have to be thorough and reliable. You have to be careful about your job. My father used to say, either you do something or you do not do something. But if you do something, do it right. Give your 100% for that thing. And that is what I'm talking about. A professional person is industrious, organized, and holds themselves accountable for their thoughts, words, and actions. He considers himself responsible that if something bad happens to that patient, I should be held accountable, or I will be responsible. So he becomes a very careful professional when dealing with the patient. Then integrity. Integrity means keeping yourself true to your words. all the day we talk about good manners, all the day we talk about high moral values, high ethical values, but at the end of the day, we are the ones who are breaking those moral values, who are breaking those ethical values, who are not caring about those principles. So this should not be the case with a professional. He should his moral integrity should be it's a very, very important thing to have a moral integrity. So if a person has high set of principles, then it should stop a professional from compromising their own principles, even if it means taking a tougher path. Integrity is bound up with being honest and upright. You stay honest with your job, you stay honest with your patients, you stay honest with your other colleagues, and you stay upright. There are times when you can make a mistake. We are human beings, we can make mistakes. Then you stay upright. You identify your mistakes, you are happy to correct your mistakes, and you hold yourself accountable. Yeah, I did this and I think I missed it, I did it wrong, and I'm sorry for that. You have to say that thing whenever you mess up with something. A professional's belief and moral values should be clear, and everyone should trust their judgment. It's like, if a person is considered having high moral standards, then he should uphold those moral standards, even if it means he has to take a tougher path. And then people will start trusting his judgment or her judgment. If a professional is morally sound, morally not corrupt, then people start trusting your judgment, that if you are doing something for your patient, you must be doing it for the benefit of the patient, not for your own benefit. That is integrity. Then there comes respect. Professionalism means being a role model in good manners to everyone around you. I love this line. This line has my heart. You have to be a role model in good manners to everyone around you. We are not, but we have to try to become better version of ourselves every single day. Every single night, whenever we are ready to go to sleep, we have to think whether we behaved professionally, whether our attitudes were friendly or not. If not, then we think about it, we correct our mistake, and we start our new day with another thought process that, yeah, today I will be a better version of myself. So you have to be a role model in good manners to everyone around you, so that people give examples, that people start giving examples of your manners to other people. Good professionals show that they respect other people by taking their needs into account, and they help them uphold and use their rights effectively. So you always take care about the rights of other people. When you start respecting other people, you take care of their rights as well. You take care of their needs as well. Emotional intelligence, one of the most favorite trait in any world-class professional. To be a true professional, one needs to stay professional even under pressure. You know, back in 70s or 80s, emotional intelligence was a very one of the least touched topics in professionalism. But these days, this thing is being researched a lot. There are books on emotional intelligence, how to behave professionally, how to behave in a good way under stress, under pressure. So you have to behave in a very calculated way, in a very good way, even when you are under stress. To be a true professional, one needs to stay professional even under pressure. They manage their own emotions as well as stay aware of other people's feelings. So you not only manage your own emotions, you not only calculate your own thought process, you not only calculate your own trigger points and deal with your trigger points, you also stay aware of other people's feelings as well, so that you do not trigger other people's feelings as well. So you become, whenever you become emotionally intelligent, your manners improve day by day automatically. So emotional intelligence is essential for good leadership qualities in any person. If you have to become a leader, a group leader or a team leader, you have to be emotionally intelligent among all of your colleagues. You have to stay calm under pressure. You have to stay professional whenever things are not in your hands, whenever things are going south. Confidence. Well-founded confidence reassures and motivates other people, boosting someone's ability to influence critical decision-making. It also pushes the person to take on new challenges without always thinking about their professional reputation. Professionalism makes you eager to achieve better results and do some more without doubting your abilities all the time. If you are confident and you know what you're doing, then you do wonders. You can deal with any kind of situation if you are confident at your skill and you do not mess it up. Then we come to the second part of our presentation or our class, and that is professional communication. So basically, whenever we talk about professional communication, we have to understand what professional communication promotes. So professional communication promotes trust between healthcare providers and patients. If your communication is professional, you are able to build that bridge of trust between the healthcare professionals and your patients. Healthy professional relationships between the professionals and the patients and between the healthcare teams as well. Mutual respect for everyone, for healthcare professionals, for the patients, and for your all of the colleagues working together, and positive workplace environment. So whenever there is a professional communication system in any institute, in any workplace, these four things get promoted. So we'll go ahead and talk about professional communication skills. If you have become a professional, and we already talked about those 7 qualities of being a good professional. There are other qualities as well, but I talked about 7 most important qualities because I have just only 1 hour, and this topic is extremely advanced topic. This topic is a very, very broad topic, but I'm trying to cover it in 1 hour, so I'm just touching the most important things. So professional communication skills, whenever you communicate with other professionals or your patients, you have to have some set of skills which are very important, which are mandatory to learn. We will talk about these skills. First of all, cohesion and clarity. Good communication is much more than saying the right thing. You have to say the right thing in the right way as well. So good communication does not mean that you say the right thing. You have to say the right thing in the right way as well, so that it becomes palatable for the patient to absorb what you are saying. It becomes palatable for your colleagues to understand what you want to say or what you are trying to say. So you have to say something, but you have to say that right thing in a right way. If you say something by shouting or in a very, derogatory manner, nobody will listen to you. So you have to say something. You have to say something right. You say the right thing in the right way as well. Your message should always be clear and concise in such a way that the recipient doesn't have to ask questions about your thought process. You always stay clear. Whenever you give a message in your professional workplace, you do not use short words. You do not use short spellings or things like that. You write or speak everything in proper pronunciation. Friendliness. A friendly attitude always sends a message that you are open to healthy communication without getting offended over minor issues. People have to think that they can talk to you without offending you. So they can pour their heart out to you without offending you. Me being a doctor, there are many instances when we are overburdenized, when there is so much burden upon us that patients feel threatened to communicate their needs with us because of the overburden, because of the stress of the environment. As there are many of the times we have to see 20 patients at a time in indoor workplace. wards, so we are not able to give proper time to the patient. But even if we give 5 minutes to any patients or 10 minutes to any patients, we try to stay friendly to the patient so that patient can pour their heart out to us, so that patient can feel safe, that they are being treated well, they are under the care of a good professional. So your friendly attitude always sends a message that you are open to healthy communication without getting offended over minor issues. So you always have to keep a smile on your face. It doesn't cost anything. Literally, it doesn't cost anything, but it gives a friendly message. People do not think about you as some alien and as some alien. They do not feel alienated themselves. They think of you as part of them, as a part of their team. So whenever you stay friendly, it gives a very good message that people can communicate their thought process, people can communicate their feelings, they can share their feelings with you. And then the most important thing, confidentiality. In order for the patients and colleagues to gain your trust, you first have to show that you will never breach their trust or share their personal details with others without their knowledge or consent. If a patient tells you something about his, for example, his drug history, but he doesn't want you to talk about it openly, then you have to, you know, you have to take care of his confidentiality. You have to pay respect to his privacy. He told you because he thought that might be affecting his health, but he doesn't want everyone else to know that he's, God forbids, he's taking some drugs. So you have to take care of his confidentiality. You never breach your the patient's confidentiality. And same is the case with your colleagues. Sometimes your colleagues tell you something about their personal lives. You do not breach their trust as well. Empathy. Being empathy to your patients always helps in gaining their trust in your abilities and your desire to help them out of their illness. You have to show that you also feel the pain they are feeling. You have to show that the condition they are suffering from, you also feel that pain. You also share their pain as well, so that patients start thinking that you are considering them a human and not just a condition. If a cancer patient tells you about his ordeal, if he tells you about his sufferings, then you have to be empathetic to that patient. Always be respectful. Always be respectful of other person's privacy as well as their opinions and cultural or social beliefs. Being doctor, I am a Muslim. I am a Muslim doctor, but I do not always treat only Muslims. I treat Jews, I treat Christians, I treat Hindus, I treat many other religious ethnicities. I treat them equally. There is not even a slight difference in my eyes whenever I'm treating a patient. A patient, being a human being, is equal to me. I respect them for being a human being. Even if he is a dacoit, or even if he is a some whatnot, even if he's a criminal or something, I have to consider him my patient. I have to trust him as a human being. So I have to give respect to that person. And sometimes when you give respect to those people, it changes their heart as well. And they start thinking that, yo, they are so good people, and why would I not be like these people? Why am I a bad person? Why I should stop doing these things? And this has happened with me as well. There were times when people quit smoking just because having a professional relationship with me. I didn't judge them, but I told them the right way, and they quit smoking. They quit drinking because it was damaging their liver. So always be respectful of others' personal privacy as well as their opinion and cultural or social beliefs. Listening. Do not listen to respond. Listen to understand the message that someone is sending. Do not listen to respond, but listen to understand what other people wants to say. Open-mindedness. Always enter the professional conversation without preconceived thoughts or an agenda. If you are going into a meeting and you have an agenda to humiliate someone, that is not open-mindedness. You are deceiving your own professional principles. You are belittling your own professional principles. You have to be open-minded. You have to understand the circumstances of other person's story. If someone is telling their part of the story, you have to consider giving a thought to their story as well. So you have to always to stay open-minded. Conflict resolution. Always try to reach a compromise instead of a conflict. The ability of a person to become a problem solver instead of a problem maker is essential for professional development. Whenever senior managerial roles are given to some people, all of these qualities are picked up in those people. Then they are given senior managerial roles in any organization. If there is merit culture in that organization, if there is no corruption in that organization, or references are not being used in that organization, then all of these qualities are seen in professionals, whether they can resolve conflicts or not, whether they are problem solvers or they're problem makers, whether they can become team leaders or not. Tone of voice. Keep your tone of voice neutral. If you shout at someone, always consider that the other person can also give you a similar response in harsh manner. If you shout, others shout, and whole of the workplace becomes tense. So your voice should always be neutral. Your voice should always be calm. Then levels of communications of health professionals. This is not the very important part of the our topic, but it is important. So I will just touch it. Communication occurs at different levels. Crafting a healthy professional relationship with your patient is an art. It really is an art. Me being in healthcare sector for the last 8 or 9 years, I can tell you, if your patients love you, you are an artist. If your patients do not love you, you're lacking something. You have to become an artist then. Communications within collaborating physicians. So if you are dealing with some patient as a team, you have to behave as a team then. Physicians often work with each other in collaboration for care of patients. Effective communication is important, particularly when it involves patient's care for some defined interval that has been preceded and followed by primary care physician too. If you are the primary care physician of some patient, and you are referring to that patient to some specialty, some specialist doctor. For example, if you are sending a patient with kidney stones to some urologist, urologists are the doctors who who specialized in the diseases of the kidneys and the diseases of the bladder, surgical diseases. Then you have to collaborate with that attending physician as well. In such settings, communication can be routine or urgent. Routine communication can take form of written notes in patients' electronic medical records or a separate letter sent to the physician's office. If you are referring some patient to some other specialized person, then you write proper notes about the patient's history and then refer that patient to the other person so that the other person has clear idea of what he's dealing with. Then there is urgent communication. Urgent communication should occur when there are adverse outcomes. These can take place by direct conversations, either in person or by telephone. Adverse events may include life-changing events, diagnosis of terminal diseases, or certainly death of the patient. So in such cases, there is need for urgent communication, and you have to be well equipped how to communicate urgently. And if we go into details of these types of communications, that is beyond the scope of our lecture. So I will not go into details of these kinds of communications because that becomes so specialized and so specific that you have to be a specialized doctor to understand all of these things. You have to be working in a hospital, but right now we are just talking about the basic principles, so I will just touch these things. Then there is communication within healthcare teams. Medical care is often provided in a team setting, and communication within these teams has become a recent focus of research. These teams include physicians, non-physicians, and mid-level providers such as nurses. Transfer of information at the time of shift change or rotations of staff is recognized as a weak point in patient care continuum. When there is shift change, there is chance of patients mismanagement or mishandling. So new research is focusing on those times when there is a chance of for patients' data not being shared with the new team, the team who is taking over the care of the patient. So transfer of information at the times of shift change or rotations of staff is recognized as a weak point in patient care continuum. The advent of electronic medical records and digitalization of healthcare system is a major step in reducing the errors, but still extreme care is necessary at the times of handing or taking over of the patient's data. Then interaction of healthcare professionals with the patient. We already talked a lot of things related to the patients. I will just touch these things and go ahead. Healthcare professionals' interaction with the patients should be characterized by polite and formal manners. Wear neat, formal dress according to the regional or local customs in a respectful way. You are wearing a neat and formal dress, but you have to wear it in a respectful way as well. Definitely according to the regional or local customs. Then start your conversation with the patients in formal greeting words according to local custom. You never start your discussions without greeting. Then you stay focused on patient's well-being and always politely guide the patient and his or family towards the best possible path for treatment, even if it is difficult or it has a more unpleasant course. Even if there is a treatment plan, but that is difficult to pursue, but it suits the patient's condition or it is best for the patient, then you go with that management plan. You go with that treatment plan and you tell the patient that it is a difficult path, but this path is best for you, and you tell the patient's family as well. So you always stay focused on patient's well-being, not some pharmaceutical company's well-being, not your own well-being, not your institution's well-being. If your institutional manager want you to run some heavy tests which are not needed for the patient's condition, you should never order them. You should never order them. Even if the workplace bosses harass you for this, you never comply. You should have the valid reason to take a ground, and that should be the patient's benefit. Interaction of healthcare professionals with the patients continued. Always accept mistakes in healthcare delivery if there is a lapse noted in patient's care. If you take credit for patient's health, then you also should accept if there is any kind of mistake which resulted in patient's increased morbidity. Delivering of a bad news or unexpected diagnosis should be done in a highly calculated, empathetic, and professional manner so that patient's family also feels safe and taken care of when dealing with health professionals. Then we come to our last slide, and that is principles of medical ethics. So Beauchamp and Childress promulgated the principles approach as applied framework for the evaluation of ethical dilemmas for individual patient decisions in medicine and surgery. And these principles of medical ethics govern our dealing with the patient, how we should deal with the patient, healthcare professionals, doctors, nurses, paramedical staff, technicians, how we should deal with the patient. So it is principle number 1, autonomy, deliberated self-rule. The patient has the right to choose or refuse their treatments. It requires physicians to consult and obtain patient agreement before doing things to them. So you always take a consent, either it is an implied consent or proper written informed consent, but you take the patient on board about what you are going to do. Then beneficence. A practitioner should act in the best interest of the patient without regard to the physician's or anyone else's self-interest. It is rule number 2 and the most important rule. You are treating the patient, and the benefit of the patient should be your number 1 priority, not your own finances, not any pharmaceutical company's finances, not your institutional finances. You have to take care of the patient's health. Then non-maleficence. Do no harm. The practitioner should avoid treatments that harm the patients. And now there are some encirclements with blue ball pen. Actually, this is my own surgery book. I took this photograph and added it into my, my presentation or my slides. So that is why you see these pencil marks. But actually, I was just reading these principles and I love these principles. So I wanted to add these principles in this class presentation as well. Then there is justice. Rendering what is due to others affects the distribution of medical care among patients and population. You have to do justice. You do not see whether a patient is poor or a patient is rich. You do not behave differently with patients or different socioeconomic status. If a poor patient comes to you or a rich patient comes to you, your treatment plan, your behavior, your management strategy should always remain the same. You have to provide justice to the humanity in giving medical care. You cannot treat poor people differently than the rich people. So that is the most important thing as well. If a poor patient comes to you, you give equally important you give equal importance to that patient as well.